Okay, the last video for this section, or for this chapter, excuse me, is going to be disorders, and we're going to focus on fractures first, and then other bone disorders. So a fracture can be broken down into different types. A stress fracture is a break caused by the application of too much force to a bone, so maybe a fall, maybe from sports or military combat. Whereas a pathological fracture is a break in a bone that's weakened by another disease. So if we talk about bone cancer or osteoporosis, which we're going to in just a minute, normally that stress wouldn't break a healthy bone, but because the bones are weakened, then those are the types of fractures called pathological fractures. Fractures are also classified by their characteristics structurally. So the direction of the fraction line, the break in the skin is open, closed, and we'll get to each of those. I will say, depending on what book you use or what resource or video, you can find multiple names for the same kind of fracture. So we're going to stick with the ones that are in the book. So that's where I would be using for your types of fractures. An uncomplicated fracture would normally heal 8 to 12 weeks, but if you're elderly or debilitated, it might be longer than that. And so then we're going to focus on the stages of these fractures. So the first is the fracture hematoma. The bleeding of a broken bone is going to form a clot first. That's all through the same process of a normal blood clot. And then the second part of that is granulation tissue. This is soft, fibrous mass, and that occurs 48 hours after injury. After that, the soft callus forms. It is where collagen is deposited by fibroblasts, and then they are converted. They convert that granulation tissue into a soft callus, and that soft callus is then converted into a hard callus, where osteoblasts make this temporary bony collar called the hard callus, and it is cemented to dead bone around the injury site. It's basically like a temporary splint that joins the two broken ends together. This takes 4 to 6 weeks for the hard callus to form, and it is important to immobilize that bone, which is why we see casts. The remodeling occurs very last. It's where the hard callus has to persist for 3 to 4 months. The osteoclasts dissolve the fragments of the broken bone, and then osteoblasts deposit spongy bone to bridge the gap between those broken ends. And then eventually that's all going to transform into compact bone. It's usually thicker in the fractured area. So this is kind of a picture version of what we just went through. So the hematoma happening first, then the soft callus, then the hard callus, eventually into spongy bone, and then finally, the last picture, everything is turned over into all new bone. Really thought this was going to list all the fractures for you. I will post a separate handout with all the listing of the fractures that we'll be using. I thought it went through here, but it doesn't. So, an open fracture means that it has broken through the skin. So an open fracture does require surgery. So let's talk about open versus closed. So closed reduction is a procedure where the bone fragments are manipulated without surgery. So it means it hasn't broken the skin, and those bones can just kind of be moved back to their original spot, and then we're using a cast. But in an open fracture, the surgery needs to occur to help put the bones, and possibly using plates, screws, or pins to realign those fragments. Casting is normally used to stabilize and immobilize healing bone. This talks about the use of traction. For fractures of the femur in children, it's very important that that bone repairs correctly, and so traction is used to make sure that they are not using that bone while it's trying to heal. This is what an open reduction ankle fracture might look like after the surgery. So we might expect to see pins. And then the last disorder we're going to talk about in depth is osteoporosis. Osteoporosis is the most common bone disease. It loses bone density over a period of time, and the bones lose mass and become brittle. It's because that they are losing that matrix and the minerals. It affects spongy bone the most, and you can see what's called the widow's hump, the deformity of the spine, based on vertebral compression fractures. Most affected by osteoporosis are women that are small, white, and after menopause. Women that smoke in this group are at the greatest risk. They begin to lose their bone mass as early as age 35, and then by 70 they've lost about 30%. So risk factors here are race, age, gender, smoking, diabetes, and then of course that diet poor in calcium. For treatment of osteoporosis, estrogen replacement therapy is an option. It slows down the bone resorption, but it has been felt to increase the risk of breast cancer, stroke, and heart disease. So scientists are still investigating those side effects. This talks about the best treatment is prevention, to make sure you're exercising and taking in enough calcium. And there's a visual image of what osteoporosis is looking like in the vertebrae, and comparing spongy bone of a normal individual and to one that has osteoporosis.